This is Helen. Helen works as a caregiver in a care center where she provides care and support to people living with dementia. As part of her job, she needs to perform psychosocial interventions that she must adapt to suit the specific needs and preferences of the individual person with whom she interacts. One way of aiding Helen with this is to provide her with manuals that can empower her work by providing her with directions concerning the interventions. However, this is made more difficult by the fact that the interventions can be complex and must be flexible enough to suit different people at different times. The purpose of this paper is to investigate manuals concerning complex interventions in dementia care in order to provide knowledge that can be applied when designing future manuals so that they may assist people like Helen when providing care for people living with dementia. We guided our work by posing the research question: how are manuals describing complex interventions in dementia care structured and disseminated in refereed journals, and what is important to consider for future manuals? We conducted a scoping review and systematically searched 4 databases. We followed the PRISMA-ScR and guided our search by applying the PICo method. We identified 882 potential records. After removing duplicates and screening abstracts and full-text articles, we included 9 papers in the analysis. We analyzed the papers using template analysis as we specifically wanted to learn about the possibility of tailoring the intervention, the flexibility of the manual, and what dissemination elements were used in the manuals. 2 manuals had a high degree of flexibility as they did not suggest any order in which the actions should be carried out, and the actions were described in low detail. 6 had a medium degree of flexibility, as they suggested an order in which the actions should be carried out, yet the actions were described in low detail. 1 had a low degree of flexibility, as it suggested an order in which the actions should be carried out, and the actions were described in high detail. It is worth noting, however, that all manuals allowed or required the user to tailor actions in the intervention to suit the specific situation. All manuals use written text as the media, while none included illustrations or audiovisual material. However, some manuals did use graphical organizers, such as lists, headlines, and flowcharts. The manuals directed the users either by providing directions, suggestions, do-nots, questions, or examples. Based on our findings, we suggest that developers of manuals consider the possibility of including illustrations or audiovisual material to provide a detailed description of the intended actions. We also suggest that the manual maintains a medium to low degree of flexibility, structures the intervention in a hierarchical order, and allows tailoring of the intervention. Our findings can be used to guide the development of manuals that can assist people like Helen in providing care for people living with dementia.